Let us continue with the 5 command points. This time we talk about lung 7, broken sequence. Lung 7 is located on the radial aspect of the forearm, directly above the styloid process of the radius, approximately 1.5 soon, proximal to the wrist joint space, or the wrist crease in a V-shaped groove. How to find lung 7? Place the palpating forefinger on the anatomical snuff box, which is Li5. From there, glide proximally over the styloid process of the radius and locate lung 7, where the finger can palpate a cleft between two tendons, brachioradialis, abductor pollicis longus, or using the tiger mouth grip. Spread the thumb and forefinger of both hands, crossing them so that the forefinger of one hand comes to rest on the styloid process of the other, but avoiding bending the wrist. Lung 7 is located directly below the tip of the forefinger in a V-shaped groove. Needling of lung 7. Lift the skin above the styloid process by pinching it. Insert the needle 0.5 to 1 soon, obliquely and proximally, that means reducing, or distally when you tonify. Caution, cephalic vein. Actions or indications of lung 7. Supports the occiput and head, releases exterior, expels wind, descends lung chi, opens and regulates Ren-Mi, regulates water passages, opens the channel and Luo-Connecting channel, alleviates pain. Special features of lung 7, Luo-Connecting point, opening point of the Ren-Mi, Madanyang heavenly star point, Kawu command point of the occiput, exit point. Lung 7 is an extremely important point, a favored point when there is grief, sadness, and oppressive feelings in the chest. Where these feelings have been held in and incompletely expressed, it can stimulate a beneficial release for the patient, often accompanied by tears. The po reside in the lung, and long-term deep sadness and grief can afflict their role in the rhythmic automatic maintenance of the processes of life, leading to shallow or constrained breathing, tension in the area of the shoulders and chest, and uneasiness of the spirit. Being the opening point of the Ren-Mi, lung 7 can open the chest and affect the upper and lower jaw. Used with kidney 6, the coupled point, lung 7 tonifies yin, regulates uterus, affects and moistens the throat, as well as stimulating the descending of lung chi and the grasping of chi by the kidney, and so is useful in chronic asthma from lung and kidney deficiency, as well as edema of the face. The far-reaching effect of lung 7 on the upper jaw also supplies a nourishing influence to the heart and pericardium meridians. The nose is the opening of the lung. Lung 7 is said to open the nose. It regulates lung chi, stimulates dispersing of lung chi to circulate the way or defensive chi, opening the pores and stimulating sweating. This ability to release exterior means it is often used in the early stages of invasion of exterior wind, colds, and flu. Lung 7 is frequently combined with Li4 or Li20 in this context. These combinations may also be used to eliminate toxins from mind and spirit. The receiver of chi needs to have the clearest chi possible. Otherwise, all sorts of distortions can occur in the body, mind, and spirit, leading to depression, narrowed perspective, loss of purpose, and a constant sense of disappointment in life. As the best point to stimulate the descending of lung chi, it is beneficial in all types of cough or asthma. Being the luo or junction point with large intestine, it can affect Li meridian as well as lung meridian problems, including neck, face, and shoulder problems, shallow breathing, oppression in the chest, as well as constipation. The lung and large intestine as receiver of chi and drainer of the dregs are key in the beginning and end of life, entrances and exits. The Luo junction point has a harmonizing action on the internal-external relationship of this pairing. Furthermore, lung 7 is seen not just as a junction point for lung, but acts to regulate and harmonize the environment for all the officials to work within because of the role of the pole in the automatic rhythmic maintenance of life. The lung controls water passages. Lung 7 affects opening of water passages and is helpful in patterns of urinary retention from deficiency, which often affects older patients. Stimulates descending and dispersing of lung qi, circulates wei qi, and releases exterior. The name of this point, broken sequence, is an ancient term for lightning. This name may be understood in three ways. First, the electric sensation that may be generated when needling this point. Second, the ability of lung 7 to clear heaviness and oppression of the chest in a way that a lightning storm clears the sky. And third, the sudden fork in the lung channel at this point. It is notable that several of the Luo-Connecting points, for example, stomach 40, bladder 58, kidney 4, are located at sites where the channel suddenly changes direction. And in the case of lung 7, this fork takes it almost as far as the pathway of the LI channel, emphasizing the close affinity of lung 7 to the lung-spared yang channel. Lung 7 was included by Ma Danyang, the great physician of the Qin dynasty, among the 11 heavenly star points, his grouping of the most vital acupuncture points, and was indicated by him for one-sided headache, wind painful obstruction and numbness of the whole body, obstruction of phlegm in the upper body, and lockjaw. The glorious anthology of acupuncture and moxibustion by the Ming Dynasty author Gao Wu includes lung 7 among the 4 command points for disorders of head and nape. In the Ode of the Obstructed River, the use of lung 7 is referred to as one of the 8 therapeutic methods. In this description of the application of the 8 confluent points of the extraordinary vessels to affect specific symptoms and areas of the body, lung 7 is indicated for disorders of head region, rebellion and blockage of phlegm, and dry throat. The clear emphasis on the ability of lung 7 to treat the head and neck region in each of these 3-point groupings is surprising, since the lung channel does not ascend higher than the throat. The effect of lung 7 on the head region as a whole can, however, be explained by the following factors. First, the action of lung 7 on expelling and pacifying wind, whose nature is to attack the upper portion of the body. And second, the close connection between lung 7, the Luo-Connecting point of the lung channel, and its interiorly-exteriorly related LI channel, which does ascend to the head.